So I'll close with a final question that's mine, which is, certainly we've all probably been privy to some of the frustration and backlash around the implementation of this across the country. I'm curious what, from each of your perspectives, whether it's cost, whether it's something that's specifically innovative about our health insurance exchange here in Oregon, or something about improving access you feel like is some good news or a hopeful message those of us who sort of represent a community of public health professionals or healthcare advocates can share with people to sort of counterbalance some of that, because I feel like there hasn't necessarily been enough about the good things that are happening out in the community. So if each of you could share something that you think is promising or that you're excited about that's happening right now, I would love to hear it. Store that in my pocket to meet the naysayers with. Give me some dollars.
Well, I think in some senses there's two things to consider. One is probably 5 years from now we won't even remember this.
I'll remember it.
Well, there'll be a few here that are scarred, but unfortunately, but the rest of us. The other thing to remember, I think, and it's something that a point that Jonah was making, I think is really important, is this is just, and I think others have made, it's just one piece of the pie. Now, what's really exciting is that in this move toward covering everyone in insurance, everyone in the business of healthcare is thinking about how to make things better. And I've been around this stuff for decades, and it's, it always goes ebbs and flows. I mean, last time I tried to do healthcare reform, people started getting all excited, and then it just died away. And as long as this keeps going, there's a lot of really important transformation, good stuff that's going to be happening. It is hard, and I think we need to pay attention to how to capture that and talk about it. I mean, John, I was really excited to hear some of the stuff that you've talked about, because that's really good, positive stuff. And we need to find that, but it's there. I mean, I think a lot of the good stuff is sort of behind the scenes, but it will, it's really quite amazing how much transformation is occurring.
I think the good news is this is working. There are places where this is working. There are states that are able to make this work and have better success, I want to say better luck, but then I don't. The news about the federal exchange sort of overshadows and covers all the exchange news. But there are states, and I think the great thing about, there's the phrase, the laboratory of the states, is that's working, because there are states where this is going much better than it is in the federal exchange. And we're going to get there too.
I think I'm very thankful I live in a state that has Medicaid expansion, and I don't know if this number is accurate, but there was a really interesting editorial yesterday talking about, I'm not sure if I totally like how he framed it, but Oregon Health Plan did better than Cover Oregon, but really it's all the same. I mean, in some ways, but 70,000 more people, is that the right number, are covered, and that's a huge success. And on the federal level, having been in health IT for 14 years, somehow landing there, people that I know that are in IT, they're like, yeah, that's a typical IT project. I mean, too bad the president didn't know that, but it's not a huge surprise, unfortunately. It just kind of is how IT projects happen. But the one story that I heard about that made it really click about kind of how on the federal level, not Oregon, why it kind of became such a disaster, is because of federal contracting, they had to spread out the work amongst so many people. And if you're trying to do programming, that doesn't really work. So that made it like, oh, no wonder. That just really clicked for me.
I have two thoughts, or two impressions. One was just a flash I had, an insight I had yesterday. I was participating in a work group. We're doing a care management kind of innovative team around serving homeless youth. And we had the steering committee of that group together, and it was doing a little kind of social worker-y type of exercise where we were visioning some stuff, and some of the members of one of the members of the steering committee was former medical director of Kaiser, who now is one of the leaders of Family Care, a coordinated care organization, and he was there with a case manager, and they were really getting into the visioning part of it in the little breakout session, and I was sitting there watching him, thinking, what a different world this is now compared to what it was, 5 years ago. That you would have someone of that stature in the healthcare system working with a homeless case manager, homeless youth case manager, visioning, how can we get better access to homeless youth? That homeless youth would even matter is a whole different world than it used to be, and I just thought that was delightful. But the other thing that I could say is positive, good news. I know that we're here at Portland State, and a lot of you are working towards a healthcare career that are in the audience, and I would just say, from my personal experience, this is a once-in-a-lifetime thing that's happening right here in Oregon. We're in the center of something that's changing the whole nation. Oregon is the center, and Portland is the center of Oregon. A lot of things happening here. And there's no better time, I can think, to be in the profession that we're in than right now. And I feel really grateful to do that, and I feel really excited by it. And I get up every day looking forward to it. So I would say this is a good place to be.